Namaste. I am Dr. Kaustabh Kalita, consultant ENT surgeon from Apollo Excelcare Hospital, Boragaon, Guwahati. Today I am here to talk about a very interesting issue in the field of ENT, a topic which has been quite bothersome in the society now, and also it's one of the most neglected topics seen in each and every household. That is snoring and sleep apnea. To start off with, what exactly is snoring and what do you mean by apnea? Snoring is nothing but when you go to sleep, your body relaxes and you have a loud sound coming more from the throat and from the nose. That is what we call as a snoring. The other thing which is associated is what we call a sleep apnea, or rather obstructive sleep apnea. Now what does that mean? So apnea means the blockage or the cessation of breathing. Obstructive means because of something which is blocking. Now things which we need to realize and understand: when we sleep, a middle-aged person or an elderly person snores, we think about the noise coming and we try to ignore it and get used to it. But it's not the noise which worries us as a healthcare provider. It's the apnea, it's the blockage which actually worries us. So what happens when we sleep? The body relaxes, the muscles relaxes, and particularly what we call the palate, the muscle on the top of the mouth along with the uvula and sometimes the tongue. So when these muscles they get relaxed, they tend to fall back, and that is when your air passage becomes or starts getting blocked. Now this is what is worrisome. So your windpipe or your air passage, when it starts to get blocked, that means the oxygen levels are also getting blocked. So it might be a 10% decrease from normal. So instead of 100%, you might be getting 90%, or it may be even severe like 75-80%. So imagine every night during your 6 hours or 8 hours of sleep, the body receives less than normal oxygen. So due course of time, say 5 years, say 10 years, that is the time when you start feeling those problems. Now what problems can you face when you have something called sleep apnea? One of the most common things seen is excessive daytime sleepiness. You woke up with a heavy head, you don't feel fresh after a good sleep, you thought so. In the morning when you are waiting alone, say you are traveling to some distance, you tend to fall asleep. But what is more dangerous, suppose you are driving alone and then you might even fall asleep while driving the car itself. So this is one of the very commonly seen situations. Then of course you have got fatigue, mental irritation, heaviness of head, headache, which is very common. The other thing to look at it is when the oxygen levels are less, the heart is under a lot of stress because of the low oxygen content. So what happens is you start having cardiac problems, and one of the most commonly seen is hypertension, which doesn't get easily controlled with medicines. People who are diabetic, that is your high blood sugar, their blood sugar level doesn't come to normal easily with medications. And of course, if it becomes very severe, even an heart attack is also quite possible. These are the reasons why we try to stress, we try to create public awareness that don't neglect snoring or your sleep apnea. Now, once you realize that yes, I might be having sleep apnea, I am having snoring every day, what is the next step you should be thinking? Ideally speaking, we work as a team, department of ENT, department of pulmonology, and sometimes the cardiac team as well. So, from simple things like your height, your weight, your body mass index, that is the BMI, your sugar levels, your BP levels, these are the basic things we should look for first. And then we conduct something what we call a sleep study. It's called a level 2 sleep study, where the technician either at your home or in the hospital, they will connect a small machine along with some wires, and we record your whole night's sleep, including your snoring, your body movements, your oxygen levels, just like we check with oximeter. This gives us a grading, whether it's a mild, it's moderate, or it's very severe. The other thing which is also done nowadays is what we call a sleep endoscopy. Sleep endoscopy is nothing but it's a procedure where the anesthesia doctor gives a small injection to go to sleep. When you start sleeping, or rather start snoring, we do a fiber optic endoscopy through the nose to see which are the areas which are getting blocked and from which areas the sound is being produced. This will give us a better look as to what type of treatment is going to suit best. Similarly, the pulmonologist would he would like to do a pulmonary function test to see the lung function capacity is okay or not. The cardiac team will take care of the heart, and it's a multidisciplinary approach. It's not one department will give a treatment. All the departments form together a treatment protocol. Treatment protocol can range from exercise, weight loss, lifestyle modifications, exercise like running, jogging, weight loss, and the dietitian also might come in. Then it can be what we call a CPAP or a BiPAP machine. And for people who are quite young at this moment, who are not very obese, very less of cardiac problems, even nowadays laser surgeries are also possible, where sleep apnea can be cured up to a great extent. So, I humbly through this video would request the public to go through it and to realize whether these are the symptoms you are living with it. If yes, then please do consult us at the earliest. Thank you.